Sir, yesterday also very few students have joined, and today also I have not seen any student yet.
I think, Dr. Sahab, if you have something in the form of presentation, you may start because the
I
video session
uh,
is being recorded. No, so you may start, and we will upload on the website.
okay, sir.
Yeah.
Okay, thank you. So, good morning, students. Today we'll start with the chapter number 3, that is Anatomy and Physiology of Various Body Systems, Part 2. In this, in this unit, you will study about the special sense organs, namely eyes, ears, tongue, nose, and somatic senses, as well as their role in vision, hearing, taste, olfaction or smell, and touch, respectively. So the objectives of this unit or this chapter is list and describe the different types of special senses and their role in the human body, the sensory organs which we have in our human body. Describe the structure and function of genital and urinary system in the body. Explain the process of oogenesis and spermatogenesis. Oogenesis means production of ovum in females, and spermatogenesis is production of sperms in males. List and write about the location of important endocrine glands, and list and describe the important hormones secreted by human body and their effect on the body. So the special senses have various feelings involved like pain, heat, pressure, and are characterized as somatic senses. First, we'll start with visual system or the whole system regarding eyes. The anatomy of eye is quite complex. The eye consists of three layers which are as follows: sclera, choroids, and retina. So, the choroid, we come to the sclera is the outer layer of eye, and the choroid is the middle layer of the eye. The anterior surface is also pigmented and forms the iris. So the iris is the uh, tissue which is giving the light, the passage for the light, and the iris has a central opening which is called pupil, which is the main aperture through which light passes in the eye. The lens of the eye is attached to the choroid layer by means of suspensory ligaments. The chamber in front of lens is called as aqueous humor, and the chamber behind the lens is called as vitreous humor. Now we come to the retina. Retina is composed of nervous tissue formed of retinal neurons, which are photoreceptors and are called as rods and cones. So rods are the intensity based receptors. So whatever will be the intensity of the light, the rods will activate them as that itself, and cones are the color receptors. Rods and cones are the two photoreceptors in the retina. From here we can see the structure of the eye. The front part is called as cornea, then there is pupil, then there is the lens, then vitreous humor, and finally there is retina in the back side. And there is one optic nerve which is present in the lower part of the eye, which continues to the brain. Now, physiology of vision. The light enters the eye through the pupil, whose diameter, as you will recall, is controlled by the iris. The change in diameter of the pupil depends on the intensity of the incident light. The aperture size of the pupil becomes smaller in size in the presence of strong light and increases in size in dim light. The light after passing through the pupil, the light falls on the lens of the eye. The lens, because of its elasticity, has an adjustable curvature, and because of the elasticity, concentrates the light into the retina. The sensitive pigments on the retina get bleached or become colorless on exposure to incident light, and this bleaching leads to generation of nerve impulse, which is further transported to the optic nerve. From optic nerve, it is transported to the brain or the optic part of the brain, and the image is formed. From the diagram, you can see the object is incident on the cornea. So the object is incident on the cornea, and then it is passed to the lens, and finally it is reflected to the retina. Now we come to the auditory system, or the ear and hearing system. The ear, in addition to being responsible for the function of hearing, is also responsible for maintenance of body equilibrium. The nerve circuit that connects the auditory organ with the brain is formed by the eighth cranial nerve, the auditory nerve. Anatomy of the ear. It is consisted of three parts: external ear, middle ear, and internal ear. External ear is also called as pinna, and the external cartilaginous skin covered structure is called as pinna. The ear canal or external auditory canal continues after pinna. The external auditory canal transmits the sound waves onto thin membrane called the eardrum or tympanic membrane. From tympanic membrane or the eardrum, the middle layer starts. The air pressure in middle ear is maintained in equilibrium with atmospheric air pressure through a tube known as eustachian tube that opens in the nasopharynx. The middle ear is made up of three bone ossicles or bones in the ear, namely the malleus, incus, and stapes. Stapes, if you will remember, that it is the smallest bone in the human body. Stapes is the smallest bone in the human body. Now, internal ear, this chamber is also called as bony labyrinth because there are many bony structures in the internal ear also. This is the whole anatomy of ear. So you can see the three bones, malleus, incus, and stapes in the middle ear, and there is cochlea and semicircular canals in the inner ear, and finally the vestibular or cochlear nerve is there for stimulation, hearing stimulation, and that is transmitted to the brain. So the physiology of hearing, the sequence of events that take place for perception of hearing of sound can be summarized as follows. The sound waves that are trapped by the pinna are directed into the external auditory canal. These waves then strike the tympanic membrane or the eardrum that produces oscillation on the membrane. These oscillations are then transmitted onto the bones of middle ear, namely the malleus, incus, and stapes. These waves are transmitted by the stapes to vestibule that transmits the sound waves into the cochlea, the main hearing organ of the ear, that is cochlea. This sets up disturbances in the fluid contained within the cochlea. These disturbances are picked up by hair cells called the organ of Corti, which are contained within the cochlear organ. The organ of Corti, by some unknown mechanism, causes the generation of membrane potential. This membrane potential is converted into accent potential, which is carried to the auditory centers of the brain through the cochlear branch of the eighth cranial nerve, which is called vestibule cochlear nerve. In the auditory centers of the brain, the information is processed and perception of sound occurs. Now, next is the gustatory system or the system of tongue and taste. The sensory system of taste is also referred to as gustatory system. In humans, taste is detected by means of taste receptor cells which form clusters called as taste buds, which are present on the surface of the tongue, about which you will study in the next subsection. So the taste buds are found on the elevated regions on the tongue called the papillae, present on the upper surface of the tongue. Now these papillae have different taste buds and they sense the taste on the surface of the tongue. You can see this. The bitter taste is perceived by the posterior part of the tongue. The sour taste is perceived by the lateral part of the tongue, and sweet and salty taste are perceived by the anterior part of the tongue. Now the olfactory system, that is nose and smell system. Olfactory system is sensory system used for olfaction or smell. The olfactory system is often clubbed along with gustatory system and is termed as chemosensory senses because both are able to perceive chemical signals. Whether it is taste or smell, both are due to some chemicals. That's why it is called as chemosensory senses. The olfactory receptors are specialized receptors that are bipolar sensory nerve cells or neurons that have two processes extending from the cell body. That's why they are called as bipolar sensory neurons. Then the somatic sensory system. The somatic sensory system is diverse sensory system consisting of receptors and processing centers which produce the vast range of sensations such as touch, temperature, proprioception or the body position, and nociception or the pain. The receptors cover the skin, epithelium, skeletal muscles, bone and joints, internal organs, and cardiovascular system. Now, somatosensory organ of touch, there are different types of cells which sense the touch that are like Meissner's corpuscles, Pacinian corpuscles, or process and bulb. These are some of the somatosensory organ for touch. Now we come to the next system, that is the reproductive system. In humans, the reproductive system is discussed generally along with the excretory system and so is collectively also known as genito-urinary system or a urinogenital system. Reproduction is the process of producing offsprings or children by the males and females. Furthermore, the mode of reproduction in humans, as in other higher animals, is sexual. The male contributes by producing sperm. The sperm fertilizes the egg inside the woman's body, which eventually develops into human child. Now, the organs of sexual organs for males is the main sexual organ is testis. The testis is the male gonad and also called as testicles. These testes are oval-shaped pair bodies which are lodged within the scrotum tissue and which produces the sperms in the testis. The main function of testes are production of spermatozoa or sperms and the male sex hormone, that is testosterone. Now the anatomy is in details. We don't have to go into details of the anatomy of reproductive organs. Now, secretions of male reproductive tract. First one is semen. The semen or seminal fluid is a secretion of male reproductive tract. It is composed of spermatozoa or sperms, prostatic secretions, secretions of seminal vesicles, and accessory sex glands. And there is second hormone, that is male sex hormone, that is testosterone. Description about this hormone is given in the further unit. A female reproductive organ. The main primary female reproductive organ is uterus and ovary. The uterus is a single central inverted pear-shaped muscular hollow organ that is necessary for the process of gestation, that is period of growth of the baby inside the mother's body in the female. And the period of gestation ideally is 9 months in humans. Now, fallopian tubes. These are two fallopian tubes on each side of the uterus. Each fallopian tube connects its ovary to the uterus. Now, ovaries are the main sex organs in females which produce the ovum inside the ovary. Closely associated with end of each fallopian tube is a walnut-sized ovary, which is the female gonad. The ovaries are paired structures that lie at the free end of the fallopian tubes. Egg production takes place within the ovaries. The two major steroid hormones produced by human ovaries are progesterone and estradiol or estrogen. The production of these hormones vary widely over the course of menstrual cycle. Now, menstruation is thus the cyclic flow of blood due to shedding of the endometrial lining from the uterus of a woman at monthly intervals. That is called as menstruation. The general duration of menstrual cycle is 28 days with menstrual flow for a period of 3 to 5 days. Menstrual cycle in women begins at the onset of puberty and continues till menopause when ovulation stops after 45 to 50 years of females. A menstrual cycle consists of the following four phases: menstrual phase, proliferative phase, ovulatory phase, and luteal phase. So we can see from this diagram that the menstrual cycle consists of follicular phase, then follicular phase, menstrual phase, luteal phase. This is the whole menstrual cycle from first day of menstruation. Now, spermatogenesis and oogenesis, the process by which the formation of mature spermatozoa and ovum takes place in males and females, respectively, called as spermatogenesis and oogenesis. During this process, the number of chromosomes in the cell is reduced from 46 to 23, that is haploid number of chromosomes, that is 2n to n number of chromosomes. From 2n, it is reduced to n number of chromosomes, that is 23 chromosomes. The cell division which causes the reduction of chromosomes from 46 to 23 is known as meiosis. Generally, when the cell divides, this process is called as mitosis. But in the reproductive organ, when the sperms and ovaries are formed, there is reduction of the chromosomes. That's why it is called as meiosis. The diploid chromosome number is achieved only after the formation of the embryo, which forms by the union of haploid gonad. Now we come to the urinary system. Urinary system deals with the excretion of liquid waste in the form of urine from the body. Structure of the urinary system: there are paired kidneys, means two kidneys, and paired ureters, which start from kidney and end to the single urinary bladder. From urinary bladder, there is one single urethra through which the urine is passed out of the body. The structure of kidney, showing the nephrons are arranged in this manner. The glomerulus and the uriniferous tubules together form a unit called as nephron. So nephron is the main unit which filters the blood and forms urine. The glomerulus is surrounded by the capsular structure of the uriniferous tubules known as Bowman's capsule. The uriniferous tubule is composed of the proximal convoluted tubule, and the tubule is divisible into various sections: the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and the collecting duct. The distal convoluted tubule or several nephrons empty into a single collecting duct. From this diagram, we can see that there is renal capsule and renal medulla, and in medulla there is single nephron, showing the position of single nephron and the collecting duct which collects the urine and then it is transferred to the ureter. Blood supply of kidney is through the renal artery. Renal means kidney, so it is supplied from renal artery, and the venous or deoxygenated drainage removal of oxygen is through renal vein. The physiology of urine formation. Nephrons have three main functions. First is filtering blood, which takes in the renal corpuscle of the uriniferous tubule. Second one is returning useful substances back to the blood so that they are not lost from the body, which is accomplished in the uriniferous tubules, and removing substance from the blood that are not required by the body, which is also done by the urinary serous tubules or the nephrons. Now we come to the another important system, that is endocrine system. The endocrine system and the nervous system together coordinate all the functions of the body. The endocrine system consists of endocrine glands. These glands of the endocrine system help coordinate functions of the body by releasing into the blood stream or extracellular fluid mediator molecules called as hormones. Hormones help in maintaining homeostasis, that is the condition in which the body's internal environment remains relatively constant within physiological limits. Now there are different types of uh, there are various types of endocrine glands called as pituitary gland, thyroid gland, adrenal gland, pineal gland, and parathyroid gland. These are some of the important endocrine glands. There are several of these hormones secreting organs and tissues in body also, which are given in the list below, such as hypothalamus, thymus, pancreas, gonads, kidneys, stomach, liver, small intestine, skin, heart, adipose tissue, and placenta. So these are all the glands which form different hormones in the body and help in the functioning of body for proper homeostasis. Hypothalamus and its hormone. It is the major integrating link between the nervous and endocrine system. Cells in hypothalamus synthesize at least 9 different hormones, and pituitary gland secretes 7 hormones. Together, these hormones play an important role in the regulation of virtually all aspects of growth, development, metabolism, and homeostasis. The hypothalamus controls the release and inhibition of hormones of the anterior pituitary. The hypothalamus stimulates the release of secretion of the anterior pituitary gland by its releasing hormones, and also suppresses the secretion of anterior pituitary gland by inhibiting hormones if it is produced in excess quantity. Now we come to the thyroid gland. The thyroid follicular cells secrete two important thyroid hormones, namely the thyroxine and triiodothyronine T4. The third hormone, calcitonin, is also secreted by the thyroid gland, and calcitonin helps regulate calcium homeostasis in the body along with parathormone that is produced from parathyroid gland. Adrenal gland. The adrenal gland has different areas such as adrenal cortex and adrenal medulla. This is present on the top of the kidney. The adrenal cortex is again divided into three parts. The outermost zona glomerulosa, which secretes mineralocorticoid hormones that help control water and electrolyte homeostasis. The middle zone, called the zona fasciculata, which secretes the glucocorticoids hormone, which affect glucose homeostasis, and the glucocorticoids regulate metabolism and resistance to stress and include the following hormones such as cortisol, corticosterone, and cortisone. The third layer, called as zona reticularis, secretes small quantities of weak steroid hormones, the androgens that are the male sex hormones. Now, adrenal medulla consists of hormone-producing cells called chromaffin cells, which surround large blood vessels. The two main hormones synthesized by the adrenal medulla are epinephrine or adrenaline and norepinephrine. The effect of these hormones is to produce a fight or flight response in case of an emergency. Whenever there is an emergency, say for example, if any wild animal comes in front of you, then either you will fight or you will flight, or means run away. So these Hormones help in the correct decision of the humans while emergency occurs in the any condition. Now pancreas. Pancreas are again one important gland which is exocrine also and endocrine also. Exocrine means it produces some enzymes also, and endocrine also because it produces some kind of hormones also. Scattered among the exocrine acini or uh, the stroma are 1 to 2 million tiny clusters of endocrine tissue called as pancreatic islets or islets of Langerhans. Now these islets of Langerhans produce different types of hormones such as the alpha cells or A cells that contribute about 20% of islets and secrete glucagons. The beta cells, which is very important for you to know, constitute about 70% of pancreatic islet of Langerhans and secrete the hormone insulin. Insulin, which is required for sugar metabolism in the body. Then there is delta cells or D cells forming about 5% of pancreatic islet cells which secretes somatostatin identical to the growth hormone inhibiting hormone secreted by the hypothalamus. Then there is F cells which contribute or constitute the remainder of pancreatic islet cells and secrete pancreatic polypeptide. Now, hyposecretion of insulin leads to the development of diabetes mellitus or simply diabetes, which is characterized by elevated blood glucose or hyperglycemia, loss of glucose through urine, that is also called as glycosuria, then excessive urine production, that is polyuria, due to inability of kidney to reabsorb water, and polydipsia means excessive thirst, and polyphagia means excessive eating. So these are some of the signs and symptoms of humans while they suffer from diabetes, such as hyperglycemia, glycosuria, polyuria, polydipsia, and polyphagia. Now the ovaries secrete two female sex hormones called as estrogen and progesterone, which help in the whole menstrual cycle and during the reproduction phase when the babies are born. These hormones help in the proper maintenance of growth of the baby also. The testes secrete the male sex hormones, that is the testosterone. Now we come to this end of this chapter. We'll continue with next chapter, that is unit 4. Now the fourth chapter or fourth unit is diseases and disorders of various body systems. Now first we come to the introduction. Even in this highly advanced diagnostic and therapeutic era, the understanding of the basic mechanism of most diseases is not clear by the humans. The term pathophysiology pertains to the study of positive factors involved in the common diseases affecting the human body. Now, objectives of the unit is to discuss the role of inflammation in the body as a protective response, describe the process and outcome of inflammation and cell injury in the human body, elaborate on the various methods adopted by cells in the human body after injury in order to adapt to the changed environment, and describe some important communicable diseases affecting humans and their mode of transmission. The first important function which happens after any injury is called as inflammation. Inflammation occurs when cells damaged by microbes, physical agents or chemical agents either initiate a defensive response called inflammation or undergo adaptation after inflammation. The four characteristic signs and symptoms of inflammation are redness, pain, heat, and swelling. So you must have seen whenever there is any injury to our body, there is redness, pain, increased heat in that part of the body, and swelling. So inflammation can also cause, depending on the site and extent of injury, the loss of function of the injured area. Inflammation is a protective attempt by the organism to remove the injurious stimuli or any microbes and also to initiate the healing process. As we'll read in this unit, inflammation traps microbes, toxins, and foreign material at the site of injury and prepares the site for tissue repair. Thus, inflammation helps restore tissue homeostasis. Inflammation is not synonym for infection. When there is infection, inflammation can occur or may not occur. Even in cases where inflammation is due to infection, it is incorrect to use the terms as synonyms, and because they are not synonyms, infection is caused by an exogenous or outside pathogen, while inflammation is the response of organism to the pathogen. Now, there are two types of inflammation. It can be either acute inflammation or chronic inflammation. Now, what is acute inflammation? Acute inflammation is short lasting, ranging from minutes to a few days, as seen in the case of throat infections, bruises, cuts, etc. Acute inflammation is the initial response of the body to harmful stimuli and is achieved by the increased movement of plasma and leukocytes from the blood into the injured tissues. Now, the fluid exudation, which moves into the extravascular space and also into the tissue, causing edema, which is manifested as swelling or tumor that is uh, exudated from the plasma to the outer space or extravascular space for proper maintenance of homeostasis and killing the microbes. Now, the outcome of acute inflammation. The possible outcomes of acute inflammation are either cessation, that is, the complete restoration of tissue after an episode of inflammation, or there may be suppuration. This is the thrombosis of the region of inflammation. Pus is a mixture of living, dying, and dead neutrophils, bacterial and cellular debris, and a small amount of lipid. Then there is organization. This is the replacement of inflamed and damaged tissue by, by granulomatous tissue or any type of connective tissue. Now, what is chronic inflammation? While acute inflammation is characterized by simultaneous destruction and healing of the tissue by inflammatory processes, in chronic inflammation, however, the duration of inflammation extends longer, and so it is called as chronic inflammation. But the mechanism of protection of body by different microbes is similar in chronic inflammation also. Now, cell injury. What is cell injury? The injury or sickness of the cell in any form due to either external physical mechanical trauma or chemical and toxins, or by microbial agents like bacteria, virus, or fungi. Nutritional causes like lead poisoning. Internal causes like enzyme defects due to genetic makeup, for example, galactosemia, which is hereditary disease caused by the lack of liver enzyme required to digest sugar galactose, or deficiency of vitamins and hormones, or ischemia, that is reduced blood supply, or immune mediated mechanisms caused by chemical, physical, or microbial agents can lead to reversible or irreversible loss of function or structure. Now, there are free radical formation during injury. Free radicals are atoms or molecules with an unpaired electron in their outermost orbit. As a result, they are highly reactive and unstable. Physiologically, these reactive species are quenched by antioxidant enzymes like superoxide dismutase, catalase, and peroxidase. These reactive species can initiate a series of reactions that have irreparable effect on cellular macromolecules like lipids, proteins, and DNA itself also. As a result, the cytoskeleton of the cell may get damaged, or the ability of the cell to synthesize proteins may be lost. Now, cell death or cell destruction can occur in the following two ways. Cell death may occur by a secondary effect after an injury, or programmed cell death, or which is also called as apoptosis. This occurs by activation of apoptotic proteins that lead to the release of hydrolytic enzymes from the lysosomes and digest the intracellular components of the cell. Now, what is cellular adaptation? Other than inflammation, the cells can adapt. That is called cellular adaptation. There are several adaptations adopted by the damaged cells, and these cellular adaptations are as follows. First one is hypertrophy. In hypertrophy, there is an increase in the cell size. The size increases due to an increase in the number of intracellular organelles. Then there is hyperplasia. Hyperplasia involves an increase in the number of cells and occurs in those organs where cell division is possible. Then there is atrophy. In atrophy, there is decrease in the size of the cells in an organ. Then there is hypoplasia. Hypoplasia means the reduction in the number of cells, which in turn leads to a decrease in the size of the organ. Then there is metaplasia. Metaplasia is a condition where one type of cell converts to any another type of cell. A common example of this condition is development of Barrett's esophagus, where the normal stratified epithelium is replaced by gastric epithelium due to constant injury from the gastric acid present in the stomach, and due to regurgitation of this gastric acid, the Barrett's esophagus forms, where the normal stratified epithelium in the esophagus is replaced by gastric epithelium. Now, communicable diseases. There are different types of communicable and non-communicable diseases. Communicable diseases are also known as contagious or infectious diseases. In these diseases, the pathogens or pathogenic organism causes disease or illness to the host, or in humans that causes the disease is called as causative organism. The causative pathogenic agent may be unicellular microbial organisms like viruses, bacteria, fungi, protozoa, or multicellular organisms, namely the parasites. These pathogens are able to cause diseases in animals, including us, because of their potentiality of transmission from one person to species to another person. So there are different types of communicable diseases such as waterborne diseases, airborne diseases, vector-borne diseases, and diseases spread through contact with the infected person. First, we come to the waterborne diseases. Cholera, typhoid, dysentery, amoebiasis are common diseases that spread through water that are contaminated with human excreta and other organic impurities from animals and vegetable sources. Now, cholera. Cholera is caused by bacteria Vibrio cholerae. The transmission of cholera in humans occurs through the intake of water or food contaminated with Vibrio cholerae bacteria. Then there is typhoid or enteric fever, which is caused by the bacteria Salmonella typhi. Then there is dysentery. Dysentery is of two types. Dysentery due to bacteria, which is caused mainly by rod-shaped bacteria called as Shigella, and amoebic dysentery caused by animal protists or protozoa, the amoeba called as Entamoeba histolytica. Then there is diarrhea. Diarrhea is caused by single-celled protist organisms, namely Giardia or Proteus or Clostridium species. Diarrhea means, in local language, we can say it is loose motion is diarrhea. Then there is hepatitis. Hepatitis implies injury to the liver characterized by presence of inflammatory cells in the liver tissue. There are different types of hepatitis virus such as A, B, C, D, E, which cause hepatitis or inflammation of the liver. Some waterborne diseases caused by helminthic infestations or parasitic helminths that infect human beings are found into three groups of helminths such as nematodes, cystodes, and trematodes. Now, airborne infections, airborne diseases. Various modes of transmission of airborne diseases are as follows. The disease may affect a person who comes in contact with sputum or other discharges of the infected person suffering from the disease or the carrier of the disease. The disease may affect a person who comes in contact with the droplets that are expelled by the infected person when he coughs or sneezes using utensils used by the infected patients, or it can also happen by inhalation of dust contaminated with discharges of a patient or contaminated with sputum, mucus, or phlegm mixed with saliva spitting out from the mouth in the form of spit by the patient. Some airborne diseases, the first and foremost is tuberculosis, and it is a bacterial disease caused by Mycobacterium tuberculosis. Nowadays, TB affects only immunocompromised, immunocompromised persons in which the immune system is not working properly, such as patients of HIV. And there is pneumonia. Pneumonia is an inflammatory illness of lung. It is often described as lung parenchyma or alveolar inflammation in which there is abnormal filling of the alveoli with fluid. Pneumonia is usually caused by bacteria Streptococcus pneumoniae. Then there is chickenpox, which is another important disease in humans. Chickenpox is highly contagious illness. It is a viral infection caused by varicella zoster virus. Chickenpox is rarely fatal, although it is generally more severe in adults than in children. The most common late complication of chickenpox is shingles, in which a painful skin rash with blisters develops in a limited area on one side of the body, often in a stripe. No specific treatment is required for chickenpox infection. The infection resolves in a couple of weeks itself. Now there is influenza, which is caused by a viral infection, and there are different strains of influenza virus, such as H1N1, H5N1. You must have heard these influenza viruses. Then the next important type of disease is vector-borne diseases. Transmission of vector-borne diseases is governed by complex interactions between the parasite, the vector, and the person infected or host. The diseases that is transmitted to humans to other animals by a vector is called as vector-borne diseases. The most important and common disease by vector-borne vector is called as malaria. Malaria is a vector-borne infectious disease caused by parasitic protozoan called as plasmodium. There are four types of plasmodium that can infect humans, but the most serious disease is caused by malarial parasite Plasmodium falciparum, which causes which is caused by which causes the brain malaria that may be fatal. The most common type of malaria is caused by Plasmodium vivax, which is generally non-fatal. The other two species are Plasmodium ovale and Plasmodium malaria, can also affect humans. The female Anopheles mosquito is the vector which is responsible for spreading malaria. When a female Anopheles bites an infected person by Plasmodium, a small amount of blood is taken in by it, that is the female Anopheles mosquito. This contains microscopic malarial parasites. Before drawing up the blood, the female mosquito injects a small amount of salivary fluid into the puncture wound to prevent blood from clotting up. After 1 week later, when the mosquito takes its next blood meal, these parasites present inside the mosquito mix with mosquito saliva and are injected into the person being bitten who gets infected by the parasite, and it can cause malaria there itself. Then there is dengue. Dengue fever and dengue hemorrhagic fever is a viral infection caused by related viruses of genus Flavivirus. Dengue is spread by the bite of mosquito Aedes aegypti, which feeds during the day. Also, so dengue is transmitted by Aedes, and malaria is transmitted by female Anopheles mosquito. Then there is filariasis. Filariasis is a parasitic infection caused by nematode parasite Wuchereria bancrofti and Brugia melai. It is transmitted from one infected person to another by the bite of female Culex mosquito, which is the vector for this disease. Filariasis disease is characterized by recurrent attacks of fever and development of swellings of the legs, hands, and scrotum. The swelling is produced by the development of microfilaria, that is the juvenile larva or young ones of the Wuchereria bancrofti in the lymphatic system. As a result, lymphatic drainage is obstructed and there is development of solid edema. Therefore, this disease is also known as elephantiasis because the legs can enlarge or swell like an elephant. So you can see this picture of elephantiasis or edematous leg. Then there is plague. Plague is a deadly infectious disease caused by bacteria Yersinia pestis. Without treatment, it has a mortality of 70%. Plague is carried by rodents, primarily rats, and spread to humans via rodent or rat fleas, which are the vector of the disease. So plague are transmitted by rat fleas. Then there is rabies. Rabies is a fatal viral disease of the central nervous system caused by rhabdovirus, Lissa virus species, which affects humans and other mammals. The disease causes acute encephalitis or inflammation of the brain. Another name of the disease is hydrophobia, which literally means fear of water. So there is fear of water after rabies occurs, a symptom shared by half of all people infected with rabies. The most common form of transmission of rabies is the bite of a rabid animal such as dogs, cats, or monkeys, or other wild animals. And rabies is one disease which is almost 100% fatal. Rabies can be prevented both in humans and other animals by vaccination, but successful treatment after development of disease is rare, and so if the infection develops, death is the most common outcome. Then there are diseases spread through contact directly. Transmission of diseases through contact, as the name suggests, requires some form of touch to spread the infection. Now, the transmission of disease may be of two types: direct contact and indirect contact. Direct contact transmission, which involves immediate contact between two people or with an animal, or indirect contact transmission that involves spread of disease by any fomite. What is fomite? Fomite refers to an object that becomes contaminated by touch and then spreads the infection by touch, such as any type of wooden structure or any type of clothes or hanky, anything can be a fomite. Some important diseases that are spread by physical contact and are discussed in the units are scabies, athlete's foot, leprosy, and venereal or sexually transmitted diseases. First, the scabies. Scabies is a common skin infection and usually transmitted by skin to skin contact or through sexual contact someone else who is infected with it. This is the human foot showing scabies infection. Now there is athlete's foot. Athlete's foot is a disease caused by parasitic fungus. The fungus infection causes scaling, flaking, and itching of the affected skin. Then there is leprosy. Leprosy, also known as Hansen's disease, is one of the oldest diseases known to mankind. It is a chronic disease caused by bacteria Mycobacterium leprae and Mycobacterium lepromatosis, which is the only causative agent of diffuse lepromatous leprosy and which could be fatal or lethal. Now, there are two types of leprosy also: tubercular leprosy and lepromatous leprosy. Tubercular leprosy, which is non-infective and is characterized as an anesthetic patch where sensation of feeling is lost. Lepromatous leprosy, which is infective and is characterized by presence of infective nodules. Or sexually transmitted disease or STDs, there are several organisms that are transmitted by sexual contact. A sexually transmitted disease or venereal disease is an illness that has a significant probability of transmission between humans or animals by means of sexual contact, including vaginal intercourse or oral sex and anal sex also. Now, some diseases that are transmissible by sexual route are syphilis, gonorrhea, or AIDS. Syphilis is a dangerous and life-threatening bacterial disease caused by bacteria Treponema pallidum. Syphilis in the patient is diagnosed by detection of microorganisms or the detection of antibodies in the blood. In its early stages, syphilis can easily be treated by antibiotics. Then there is gonorrhea. Gonorrhea is caused by bacteria Neisseria gonorrhea. Then there is AIDS, which is very important disease nowadays. AIDS is a potentially lethal sexually transmitted disease and is caused by a retrovirus known as HIV or human immunodeficiency virus. It can be spread either through the secretion of reproductive organs during intercourse, sharing of contaminated needles, or during blood transfusions and transplacental transfers from mother to fetus in the pregnancy period. HIV invades and destroys the immune system, which protects the body from infection, and so AIDS is characterized by rapid fall in CD4 lymphocyte count in the blood, which is responsible for protection by different microbes. Since these lymphocytes are responsible for maintenance of immunity of an individual, the person becomes immunocompromised and susceptible to other opportunistic infections like TB infections, herpes infections, parasitic infections of the GIT, and may die from diseases that are harmless to any healthy immuno, non-immunosuppressed individuals. Okay, now this chapter is also over. We will continue with chapter number 5. Now, this is the chapter called as Diseases and Disorders of Various Body Systems, second part. Now, the objectives of this unit is to list and describe the various disorders of cardiovascular, digestive, respiratory, nervous, endocrine, and urinary systems, and discuss the main features of various diseases affecting the eye, sex organs, and neoplasms. Neoplasms are the cancers. So, first, the disorders of cardiovascular system. The cardiovascular system, as you will recall, consists of blood, heart, and blood vessels. So, first important disease affecting the cardiovascular system is the hypertension or high blood pressure. Second one is hypotension, is low blood pressure, and the third one is myocardial infarction, or in local language which we say heart attack. Then there is angina pectoris, a pain syndrome associated with myocardial ischemia, in which there is partial obstruction of blood flow in the coronary arteries in the heart. If the angina pectoris is there, that means there is some obstruction in the blood vessels of the heart, and it can cause myocardial infarction or heart attack. Then there is arteriosclerosis. Arteriosclerosis is a disorder associated with loss of elasticity and narrowing of the lumen of arteries due to thickening of walls of arteries. Then there is congestive heart failure. Congestive heart failure is characterized by a decreased blood flow to the various organs of the body due to failure of pumping action of the heart. Then there are different types of arrhythmias or dysrhythmias, in which there is general term that refers to a irregularity in the heart rhythm or heart rate resulting from a defect in electrical conduction system of the heart, which mainly consists of SA node and AV node, if you will recall the previous units. Now then there are disorders of digestive systems such as constipation. Constipation is a condition characterized by infrequent or difficult defecation caused by decreased motility of the intestines. Then there is diarrhea, which we discussed previously also in communicable diseases. Diarrhea is a condition characterized by an increase in the frequency of loose or liquid bowel movements or defecation. It also causes an increase in the volume and fluid content of the feces. Diarrhea is caused by increased motility of the intestine and decreased absorption by the intestines, which results in the passage of poorly formed stool. Then there is nausea and vomiting. Nausea is a distressing feeling prior to vomiting. The feeling may arise due to psychological stimulation or irritation of upper gastrointestinal tract. Vomiting is the sudden expulsion of gastric contents of the upper gastrointestinal tract through the oral cavity or the mouth. Then there is gastritis. Gastritis is an acute or chronic inflammation of the gastric mucosa or mucous membrane due to exposure of an irritant or infectious organism. Then there is peptic ulcer or the gastric ulcer. Peptic ulcer is characterized by ulceration of the gastric or duodenal mucosa of the GI tract. The causative agents of peptic ulcer are excessive gastric acid secretion in the stomach, or Helicobacter pylori, a bacterial infection, or consumption of irritant substances and drugs such as aspirin. Then there is hemorrhoids. Hemorrhoids are commonly called as piles. This condition is characterized by presence of dilated varicose veins in the rectum or around the anus and loss of blood. Now we come to the disorders of respiratory system. First is the Cheyne-Stokes breathing. Cheyne-Stokes breathing is a condition characterized by repeated cycles of irregular breathing that begins at first with shallow breaths and then increases to periods of rapid and deep breathing, followed by a period of 15 to 20 seconds of no breathing. Cheyne-Stokes is normal in infants, but in adults it can be due to some disease. Then there is dyspnea. Dyspnea is defined as difficulty in breathing. Asphyxia. Asphyxia is a condition that arises due to oxygen starvation. Then cyanosis. Cyanosis is a condition characterized by bluish discoloration of the skin, which can be seen easily in nail beds and the mucous membranes. This is mainly because increased concentration of non-oxygenated hemoglobin more than 5 gram per dl in the blood. Then there is apnea. Apnea is a temporary cessation of respiration. It is generally seen in Cheyne-Stokes breathing. Then there is pneumonia. Pneumonia is an acute infection or inflammation of the alveolar spaces of the lungs. Pneumonia causes dyspnea, also called as dyspnea, and improper oxygenation of blood. Bronchitis. Bronchitis is the inflammation of bronchi of the lungs due to microbial infections. Then there is another important disease, that is asthma. Asthma is disorder characterized by chronic airway inflammation, airway hypersensitivity to a variety of stimuli or any type of allergy, and airway obstruction. Now, disorders of the nervous system. First important disease of psychiatry is schizophrenia. Schizophrenia is a functional disorder of nervous system and is characterized by split personality, and the person may become mad. Mania. Mania is also a functional disorder in which the individual show extremely elevated mood, energy, unusual thought patterns, and sometimes psychosis or suffering from abnormal condition of mind. So there may be sometimes elevated mood and sometimes very depressive mood. That is called as mania. Then there is Parkinson's disease or Parkinsonism, that is a progressive neurodegenerative disorder of central nervous system due to degenerative changes in the basal ganglion of the brain. Then there is Alzheimer's disease. Alzheimer's disease, also known as Alzheimer's, is a neurodegenerative disease characterized by progressive cognitive, that is thought process deterioration, together with declining activities of daily living and neuropsychiatric symptoms or behavioral changes. The most striking early symptom is loss of short-term memory, that is called as amnesia. Then convulsions. Convulsions is a condition characterized by involuntary spasmodic contraction of the skeletal muscles. It can cause epilepsy. Epilepsy is a chronic disorder of nervous system characterized by brief, unprovoked episodes of seizures. Then there is meningitis. Meningitis is caused by infection due to bacteria like streptococci, meningococci, haemophilus influenza, etc. The infection causes the inflammation of the meninges or the covering of the brain, which results in high fever, severe headache, stiffness in neck, nausea and vomiting, and visual and hearing disturbances. Viruses that can cause meningitis are enterovirus, herpes simplex virus type 2, and varicella zoster virus. Then there is encephalitis. It is associated with pathological changes in the gray and white matter of the brain, Symptoms of encephalitis are similar to that of meningitis. Polio, another important disease. Polio or poliomyelitis is a condition resulting from destruction of upper motor neurons by a virus. This causes paralysis, wasting of the skeletal muscles, which are supplied by the affected neurons, and acute inflammation of the brain. Then there is narcolepsy. Narcolepsy is a neurological condition characterized by excessive daytime sleepiness. Now, disorders of the eye. The science of study of structure and disorders of eye is also called as ophthalmology. Now, refraction of light rays. You will recall that when light rays travel through a transparent substance such as air and passes into a second transparent substances that has different density, like for example water, then the light rays bend at the junction point between the two. This bending is called as refraction. In the eyes, similarly, when the light rays enter into the eye, they are refracted at the anterior posterior surface of the cornea. Both surfaces of eye further refract the light rays so that they come into exact focus on the retina after refraction from the lens. Now, there are different types of errors of refraction or diseases of refraction. The normal eye is called as emmetropic eye. The errors of refraction that occur in the eye can be classified as myopia, hypermetropia, and astigmatism. First, myopia. Myopia is also known as short-sightedness. Myopic individuals can see nearby objects clearly but have trouble seeing far away objects clearly. Then there is hypermetropia. Hypermetropia is opposite to myopia. Hypermetropia is also known as hyperopia or farsightedness. People suffering from hypermetropia have difficulty in seeing nearby objects clearly. They can see far objects clearly, but they cannot see nearby objects clearly. Then there is astigmatism. Astigmatism is another error of refraction in which the rays are not sharply focused on the retina. This defect is either due to lens or cornea having an irregular curvature or the curve. Cataract. It is another important disease in eye. Cataract is a disorder arising visually in the old age, but may also occur due to injury, excess exposure to ultraviolet rays, and some medicines or complications due to some diseases like diabetes. In this disorder, the lens of the eye becomes opaque and so become cloudy. The only corrective treatment is through the surgical removal of the opaque lens, and after that, use of glasses or implantation of an artificial lens inside the eye. Then there is glaucoma. Glaucoma is a major cause of blindness and so is a serious condition. It arises from an increase in the intraocular tension in the eye due to buildup of aqueous humor within the anterior chamber. So when there is excess production of aqueous humor and it increases the intraocular tension in the anterior eye, that is called as glaucoma. Then there is conjunctivitis. Conjunctivitis or pink eye is an inflammatory condition of conjunctiva, the outermost layer of eye that covers the sclera of the eye. This is the diagram of conjunctiva. Color blindness. Color blindness is a genetic disorder arising due to a defect in the cone cells present in the retina of the eye. As a result, the person is not able to distinguish certain colors, not all the colors, but some colors. Then there is night blindness. Night blindness or nyctalopia is it is a disorder arising from a defect in the rod cells located in the retina, which is characterized by blindness during the night time. Now, disorders of the endocrine system. First, the disorders of anterior pituitary gland. Hypersecretion or excess secretion of growth hormone in the childhood can lead to gigantism, that is, abnormal increase in length of long bones, and the person can become very tall and large. Hyposecretion or less secretion of growth hormone in childhood can lead to dwarfism, in which the patient is below normal height. or DORF. Disorders of the thyroid gland. Thyroid gland dysfunction can be classified into hypothyroidism and hyperthyroidism. Hypothyroidism is a condition which develops due to deficiency of thyroid hormones. In childhood hypothyroidism, it leads to development of cretinisms, which is associated with stunted growth, bloated face, and decreased IQ. In adults, hyposecretion of thyroid gland leads to the development of myxedema and goiter. Myxedema is characterized by a puffy face with dry skin, scanty hair, tendency to gain weight, slow heart rate, low body temperature, and dulling of mental function. Goiter is a condition of hypothyroidism in which there is swelling in the neck due to enlargement of the thyroid gland for compensation of the decreased hormone production. So when there is decreased thyroid hormone production, the thyroid gland swells in the neck, and this is known as goiter. Now there is hyperthyroidism. There are many reasons that can cause hyperthyroidism, like follicular cancer of the gland, Graves' disease. Graves' disease is an autoimmune disorder. A primary sign of Graves' disease is enlarged thyroid and peculiar edema behind the eyes, which causes the eye to protrude outside. Now, disorders of adrenal glands such as Addison's disease. Addison's disease is also called as chronic adrenal insufficiency or hypocortisolism or hypocortisolism. Cushing's syndrome. Cushing's syndrome is caused by increased secretion of cortisol hormone by the adrenal cortex. Then there is pheochromocytoma. Pheochromocytoma is a disorder that develops due to benign tumors of the chromaffin cells of the adrenal medulla called pheochromocytomas of the adrenal medulla. Now, disorders of the next gland is disorders of the pancreas, such as hypoglycemia, is a condition associated with increased production of insulin by the pancreas. Hyperglycemia is a condition arising due to decreased production of insulin or due to ineffectiveness of insulin on target cells. Hyperglycemia is a condition that occurs in people suffering from diabetes. Disorders of sex organs. Disorders of the male sex organs, such as hydrocele. Hydrocele is a condition in which there is accumulation of fluid in the scrotum. Then, prostatic enlargement. The enlarged prostate gland of the male reproductive system causes difficulty in the passage of urine, urinary retention, and incontinence, that is, involuntary leakage of urine by the person. Then there is impotence. Impotence refers to inability of the male member to attain or sustain an erection that is satisfactory for normal coitus. The reason may be psychological, neurological, and pathological also. Disorders of the female sex organs. Mastitis refers to the inflammation of parenchyma cells of the mammary gland, which may progress to an infection. Ovarian cyst, it is common form of ovarian tumor. Then endometriosis. Endometriosis is the disorder characterized by growth of endometrial tissues, inner uterine layer outside the uterus also. So uterine tissues are present outside the uterus, then it is called as endometriosis. Then vaginitis. Vaginitis is an acute inflammation of vaginal mucosa leading to vulvovaginitis. There are several different kinds of vaginitis, each of which have their own causes and symptoms, such as candida infection, bacterial vaginosis, trichomoniasis, and non-infectious vaginitis. Then there is dysmenorrhea, which is a medical condition characterized by severe uterine pain during menstruation. Dysmenorrhea may coexist with excessively heavy blood loss, that is menorrhagia. Amenorrhea. Amenorrhea is a term that refers to the absence of menstruation. Now, disorders of urinary system. First, renal calculi. Renal means kidney and calculi means stones. So, renal calculi are also known as renal stones or kidney stones. Renal calculi can vary in size from a small particles such as grains of a sand to as large as a golf ball. The episodic pain in the renal calculi in the abdomen is called as renal colic. Now, cystitis. Cystitis is a term that refers to an inflammation of the urinary bladder. Glomerulonephritis. In this, the glomeruli become inflamed and impair the kidney's ability to filter urine. Uremia. Uremia is a term that loosely describes the metabolic disorder accompanying severe kidney damage that leads to kidney failure, also called as renal failure. As a consequence of uremia, the uric acid levels in the blood increases. Now, neoplasms. Neoplasms and the study of neoplasm is called as oncology. Neoplasms can be either malignant or benign, that is harmless. Benign tumors are less damaging to the host and are localized, whereas malignant tumors are more aggressive and spread to different parts of the body, adversely affecting its normal functioning. Malignant tumors are also referred to as cancers. So, first one is benign tumors. Benign tumors have a well defined shape and are generally spherical or ovoid in shape with a capsule around them. They do not invade adjacent tissues. Some examples of benign tumor are uterine fibroids or skin moles. The moles on our skin is also a type of benign tumor. Now, malignant tumor. Malignant tumors have irregular shapes and lack a capsule covering. Their margins show infiltrations into the adjacent tissues. The cancer or malignant cells have the ability to undergo metastasis, or in the other words, spread to different parts of the body. Some examples of malignant tumors are leukemia, that is blood cancer, malignant melanoma, and breast cancer. Now, etiology of cancer. The development of cancer is an interplay between various carcinogenic factors and the body's innate resistance to development of neoplasms. Various factors like genetic predisposition, cigarette smoking, alcohol, chemical carcinogens like benzene, asbestos, irradiation with ultraviolet rays, X-rays, etc., have been implicated in the development of different neoplasms, made benign or malignant. Now, treatment. As at present, the treatment modalities of neoplasms include surgical removal of the tumor. For cancer, however, apart from surgical removal, radiation therapy and chemotherapy with anti-cancer drugs are the lines of treatment that are used. The prognosis of any neoplasm depends on the severity and the type of neoplasm involved. Prognosis means the future condition, what will happen, or the outcome after any disease is called as prognosis. Now, this chapter is also over. You can read the summary. In the meanwhile, we will start the sixth chapter. This is the last chapter for today. So, the sixth chapter is diseases and disorders of various body systems, part 3. The objectives of this unit is to enumerate different disorders of blood, discuss various disorders of the skeletal system and joints, the various vaccines used in prophylaxis of diseases, and discuss the various immunization schedules. First, the disorders of blood. First and foremost, and very important disease is anemia. Anemia is defined as a qualitative or quantitative deficiency of hemoglobin, a protein found inside our red blood cells, which we have discussed in the earlier units. This may occur due to loss of RBCs during bleeding, destruction of RBC, or due to decreased production of RBC. Anemia is also caused by lack of iron in the body. Now, anemia can be of two types: iron deficiency anemia and hemolytic anemia. Iron deficiency anemia is the most common type of anemia and is caused by inadequate absorption of iron, excessive loss of iron, and increased iron requirement or insufficient intake of iron. Now, iron deficiency anemia can also be classified into three groups: megaloblastic anemia, that is caused by inadequate intake of vitamin B12 or folic acid; then pernicious anemia, that is common form of B12 deficiency anemia; and hypoplastic and aplastic anemia. This type of anemia occurs due to varying degree of bone marrow failures. If the bone marrow function is reduced, it is hypoplastic anemia, and if the function is totally absent, it is known as aplastic anemia, which is very severe disease. Then hemolytic anemia. Hemolytic anemia involves the destruction of RBCs in the blood or by macrophages in the liver and spleen. It is of different types such as autoimmune hemolytic anemia. In this type of anemia, antibodies are produced against the patient's own RBC, causing destruction or hemolysis or RBC destruction. Now, there is one reaction after blood transfusion. If the patient receives a blood possessing antigen different from its own different blood group, that is, somehow, if a person having blood group A receives a blood of B, then antibodies against this are produced in the body, and this may lead to hemolysis or destruction of RBCs. Then there is sickle cell anemia. In this disease, genetic abnormality leads to synthesis of abnormal hemoglobin. These abnormal hemoglobin molecules are misshaped when deoxygenated and give a sickle shape to the erythrocyte. Sickle is a instrument used by the farmers, and you can see in the diagram also what is a sickle cell anemia. Now then there is thalassemia. In this disease, there is reduced synthesis of globins, which causes further reduction of hemoglobin production and increased friability of the cell membrane of the RBC. Anemia occurs due to early hemolysis in thalassemia. Then there is normocytic anemia. In this type of anemia, the cells are normal, but their number is reduced. Now there is leukopenia. Leuco means white and enia means blood. So in a condition in which there is total blood leukocyte count is less than 4000 per millimeter cube, it is called as leukopenia. In simple words, we can say it is reduction of WBC in our blood. Then there is thrombocytopenia. Thrombocytes are also called as platelets, and enia means blood. So in this, the decrease of blood platelets come down to less than 1 lakh per millimeter cube. It should be above 1.5 lakh per millimeter cube, then it will be a normal thrombocytes in the blood. Leukemia. The term leukemia refers to a group of bone marrow cancers which results in uncontrolled increase in the production of white blood cells. It can be acute leukemia and chronic leukemia. Then there is varicose veins. It is a condition in which the vein becomes dilated and the venous walls do not close to prevent backward flow of the blood. The veins lose their elasticity and become twisted in appearance. This is mainly present in the persons who have long duration of standing in their duty time, such as traffic police officers. Then disorders of skeletal system and joints. Joint pain and inflammation may be caused by many things. Some inflammatory joint disorders cause pain and suffering, that is arthritis, which describes many inflammatory or degenerative diseases that damage the joints in between the bones. Not disorders of skeletal system. First one is osteoporosis. It is a disease of bone that leads to an increased risk of fracture. It is in this disease the bone mineral density is reduced and bone microarchitecture is disrupted. It is a condition of porous bones in which bone mass, that is, the amount of bone tissue, is reduced because of bone decay outpaces bone deposition. It is due to depletion of calcium from the body. Then there is rickets and osteomalacia. Osteomalacia is general term for the softening of the bones. These are bone disorders in which bone fails to calcify or calcium deposition. Rickets occurs in children and osteomalacia in adults. They are caused due to deficiency of vitamin D, either due to insufficient sunlight or lack of vitamin D or malabsorption of vitamin D. Then there is myeloma, which is the presence of tumors in the bone or in bone marrow. Fracture, a painful condition arising due to break in the continuity of the bone architecture. It is caused due to mechanical trauma. Now, disorders of joints. First one is arthritis, a form of inflammatory disorder characterized by changes in the joints that result in restriction of locomotion. On the basis of etiology, arthritis can be divided into two types mainly. First is rheumatoid arthritis. It may be caused due to infection or idiopathic and is characterized by inflammation of the small joints. Next one is osteoarthritis, which is more extensively involvement of joints as compared to rheumatoid arthritis. It generally involves the weight bearing joints such as tibia and femur joint or metatarsal joints. Gout. Gout is a state of intermittent episodes of acute arthritis of peripheral joints. The uric acid is a waste product of metabolism of nucleic acid, that is DNA and RNA, and destruction. Example, treatment with in malignancy and in anemia. Gout is caused by accumulation of sodium urate crystals in joints and tendons. These crystals irritate and erode the cartilage and cause acute inflammation, swelling, and pain. Now, immunity. What is immunity? The term immunity refers to the resistance shown by the host towards injury caused by microorganisms and their products. When a microorganism comes in contact with the host or any human, various defense mechanisms of the body are activated. The ultimate aim of the defense system is to recognize, destroy, and eliminate the foreign material or any microbes which is present in the body. Types of immunity. Immunity can be divided into two types: innate or natural immunity and acquired immunity. First, innate or natural immunity, which is the genetic and the constitutional makeup of the human beings. Innate immunity can be of three types. It may be species specific or racial specific or individual specific. Then acquired immunity. The immunity that is acquired by an individual during life is called as acquired immunity. Acquired immunity is of two types, either active or passive. Now, active also can be natural or artificial, and passive also can be natural and artificial. First, what is active immunity? This immunity acquired by an individual as a result of infection or by specific immunization or vaccination is known as active immunity. In this immunity, the body makes the antibodies by the products after we give any vaccine or due to any natural infection, the antigen that is present in that microbe causes production of antibodies in the body. So there is no direct antibodies production. Uh, there is no direct antibodies given in the body. We give any antigen such as any vaccine or any natural infection, which in turn causes antibodies to form in the body. This is called as active immunity. So what is passive immunity? In passive immunity, there is in which we give the antibodies or immunoglobulins itself to the body is called as passive immunity. Now, first, what is natural active immunity? It develops by a clinical or subclinical infection with an microorganism. Artificial active immunity. This immunity is developed by vaccines. So, in both these conditions, there is production of antibodies in the body itself. But in passive immunity, it is a type of immunity which is transmitted to a recipient in a ready-made form. In this type of immunity, the ready-made antibodies are given and recipient's immune system plays no active role. So we directly give the antibodies or immunoglobulins to the body, and thus the recipient's immune system plays no active role but only passive role. Now, passive immunity can also be natural or artificial. Natural passive immunity is the resistance that is transferred from the mother to the fetus in the pregnancy. Maternal antibodies are transmitted to the fetus through the placental blood and give immunity to the infants for several months. Artificially produced passive immunity is the immunity in which we inject any type of antibodies or antisera or immune sera. So, immunological formulations, these are immunological products which on administration induce or modulate immunity. They are broadly classified into active immunization and passive immunization. Active immunization is through ingestion, insertion of vaccines in the body. The vaccines can be of different types, such as toxoid or bacterial or viral vaccines. Then it can be killed or live attenuated vaccines for bacteria and killed and live attenuated vaccines for viral vaccines. What are toxoids? Toxoids are toxins that are toxic substances produced as byproduct of metabolism of pathogenic microorganisms. These are of two types, endotoxin and exotoxin. Now, what is passive immunization? Passive immunization can be further divided into two categories, that is antisera and immunoglobulins. Antisera can be further divided into four categories, such as antitoxin, antiviral, antibacterial, and antivenins. While immunoglobulin, normal human immunoglobulin, hepatitis B, rabies, measles, tetanus, etc. So for passive immunization also, there are different types of immunoglobulins such as human immunoglobulin or equine immunoglobulin, and antisera, which can be either antitoxins such as botulinum, gas gangrene, diphtheria, tetanus, staphylococcus aureus, antiviral sera such as rabies antiviral antisera, or antibacterial sera such as leptospira antisera, or antivenom after any snake bites or any scorpion bites, that is antivenoms. Now, what is immunoglobulins? Immunoglobulins are antibody preparations obtained from human plasma or serum. This human immunoglobulin is then transferred to the human body if they need any passive immunization, such as in case of any bite of a rabid animal. Then, if it is severe bite, then we give human immunoglobulin of rabies to that person. What is immunization? Immunization is the process by which immune system of a human becomes fortified against an agent known as immunogen or antigen. Immunization can be done through different ways, but the most common technique is vaccination. Now we come to the general schedule of vaccines. The national immunization schedule had different types of vaccines according to different age group. First, in the pregnant women, they give two tetanus toxoid, but nowadays tetanus and diphtheria toxoid in the pregnant women at least 1 month apart. So when the pregnant woman comes to the clinic for registration, we will give the tetanus diphtheria toxoid as soon as possible, and the second tetanus diphtheria toxoid after at least 1 month of first dose. Then we come to the vaccines under children. First, at birth, we give BCG vaccine, hepatitis B vaccine, and OPV vaccine. Then, at 2 months, we give pentavalent vaccine, OPV vaccine, and OPV vaccine, pentavalent vaccine, PCV vaccine, and fractional IPV vaccine in 2 months. Then, 2 to 4 months, same pentavalent vaccines and not FIPV is not given and PCV is not given in 2 to 4 months. Then 4 months, pentavalent vaccines, OPV vaccines, then rotavirus vaccine, PCV vaccine, and the fractional IPV vaccine. Then at 9 months, they give MR vaccine, that is measles rubella vaccine, and vitamin A, and if it is the area is prone to Japanese encephalitis, we give Japanese encephalitis vaccine and PCV vaccine, that is the booster dose. Then at 12 to 24, 16 to 24 months, we give OPV booster dose, DPT booster dose, or and we also give MR second vaccine and JE second vaccine. Then at 5 years, we give DPT vaccine, and at 10 years and 16 years, we give TD or tetanus and diphtheria toxoid vaccine. So we have completed this module also. You can read the summary and then we will discuss the rest of the chapters tomorrow. Anything you want to ask? Anything you want to ask?
No, sir.
Everything is clear. Please read the modules again so that you can gain the knowledge properly,
Okay, sir.
and you can revise these modules so that you can retain whatever you have studied.
Okay. Thank you, sir.
Okay, then today's lecture is over. We will meet again tomorrow with rest of the chapters. Okay, thank you so much.
Thank you, sir.
Okay.